Constraint is important. It's part of our fabric, and as governments and public service agencies, regional health authorities, and school divisions, that constraint actually inspires us to think about even better ways of conducting our work and doing our work. Now, the negative here is we don't have a profit motive. And the difficulty with that, and I'm not taking, this isn't about a political statement, this is just about the reality that there isn't that constant drive that a competitive environment creates that allows you that if you don't learn, if you don't try some things, if you don't take some risks, you're going to die. The organization will not succeed. In government, there's a tendency to prop up these organizations, and even if the decisions and the direction isn't wholeheartedly the right way to go, they still endure, this long, slow death that we all live with, right? So let's pick a metaphor. What we're really trying to do with lean, if this is a forest and the undergrowth is built up, we're trying to create controlled burns. We're trying to create that agitation to the status quo to be able to say there is a better way. And the benefits that we have over the manufacturers, or many of you, is that our customer is right there. For many of our services in the service sector, they're right there. We don't have to talk about them in statistical terms alone. We don't have to look just at charts and try and visualize what it must be to be them. We get to walk with them. And if you get away from your silos and walk with the patient through a myriad of processes, you start to see with new eyes all of the challenges that we've placed before them. So acute care gets a lot of exposure. Hospitals, it's all about acute care. And I suppose it makes sense in healthcare or in government that you go to your high-cost, high-volume, problem-prone areas. But the real gold isn't going to be there. We'll certainly wrestle down those wait lists, and we'll resolve our flow issues, and we'll be able to, and we've proven that we can create a really great experience. We're working at that. But if you want to be truly patient first, and in your heart know that this is what our driving purpose is, then don't be a patient in the first place. Avoid that. Look at what is it today that brought you to our emergency room, and how could we have avoided it? So I said two things. One is focus on those you serve. Patient first. In education, student first. Cross-government, citizen first. And that could take the form of an individual citizen or a business. What is their rock in their shoe? What is it that they spend time doing that could be viewed and would be viewed as waste or value? And how can we work collectively, not only as siloed ministries or siloed sectors, but the ultimate aim is across all of those jurisdictions. So I said two things. Put the person you're serving or the business you're serving, the customer, at the center. And by doing that, answer the why. Very closely associated with that is engaging those in the know. So as a health system across Saskatchewan, we have 44,000 staff. Across education, 23,000 staff. Across executive government, 12,000 staff. Even if you thought you could lock yourself into a corporate boardroom and come up with the best ideas in the world, I challenge you to race 44,000, 23,000, and 12,000 people coming up with everyday lean Kaizen improvements. I challenge you to think about the exponential effect. If we can get to small tests of change that are going on a continuous basis, as opposed to once a 12-month period, somebody comes out with a budget, a strategy, a strategic document, we come down from the mountain and we say, here's what it is, we're going to do these things. And again, I'm not trying to discredit it. I mean, vision is important, leadership is essential. But I would race you any day of the week to think that one person or a handful of people can think like thousands of people who are interacting with our customers, our patients, our students, our citizens, each and every day. Now you wonder about it and you look at it and you say, healthcare is screaming for additional resources. Go ahead, put more into that, okay? Just add more into that and see what the outcomes are. Or do we get to a fundamental rethink in terms of the approach within healthcare by starting to look at cross-functional teams and extending beyond that in terms of what brought you here today? I mentioned a high-performing UK hospital. What they did was they continually asked, what was the crisis that brought you to our emergency department? They treated every unanticipated admission to hospital, other than elective procedures, as a defect. What did we not do in the community that we could have done in a supportive way to have avoided this crisis in the first place? Could you imagine? What does that drive you towards when you're going zero defects as our target? It drives you to look back, look into the community, connect people up with primary care, to be able to say, what is it in the community that we need to provide? Are there solutions? Are there innovations? Is there some creativity? And if we get the right teams together, I think it was Stephen Spear who said, two things. Usually government guys can only remember three, so it's always good to have two things, right? So two things. One is have the humility to know you can be so much better. And two, have the optimism that if you gather the right players, you can solve any of it. It's just a matter of bringing the right players with the right tools, the time, and the commitment to get it done. So we tried something in Saskatoon, and this is something that I think is a bit unique to us, not unique to you in industry. Every day, our 14,000 staff belong to a unit or units, and they huddle. And they huddle around a board that shows this type of data, but also the metrics that they're monitoring. And they're doing all of the asking of why. There's also an emergence of rocks in their shoes and a bit of an exercise where they're posting ideas in areas that need improvement. So they're doing some daily Kaizen. And no, it's not all the same everywhere, but it's starting to emerge where there's a greater consistency and level of engagement. This is being done in hallways and out in the open in many areas, just for lack of space, but it's a level of transparency. So it's not unusual in these huddles that I've attended where patients are actually joining in or family. These are out there, they're walls, and there's an ability to talk. They're looking at infection rates, they're looking at medication errors, they're basically opening their kimono to all things that normally would be hidden from the system, and certainly from the public. But change is hard, okay? So control burns, continue to focus in areas of improvement, undying commitment to those we serve and those that serve them. That is lean. I'd rather call it value, I'd rather call it hope, I'd rather call it improvement, I'd rather call it something else. But the reality is, this is not going away. It's 60 years old. We're so far behind in the public sector, we think we're ahead because we've been lapped, okay? I want to thank you very much for your time. I really appreciate this opportunity, and it's with the deepest of humility that I present to you. I'm a student, and I think my approach is continually changing. And it certainly isn't about knowing. It's about trying to learn from you and try things. Thank you.